Hi guys, today our topic is heart arrhythmias. Come on, let's watch Dr. Ayong's daily life.
Well, I feel like my heartbeat was irregular lately. Sometimes it beat really fast, and I feel dizzy and fatigued. I'm worried about my body.
Okay, let me check for you. Wenxian, please help him take his blood pressure and measure his heart rate.
Doctor, his blood pressure is 120/74, but the heartbeat is 120 beats per minute.
Your heartbeat is a bit too fast. How long has the situation lasted?
In about 2 weeks.
How is your daily routine recently? Do you get enough sleep? Are you feel stressed?
I've been staying up late working on my assignments, and my quiz result just came out. I'm not satisfying on it. I feel stressed, and I cannot sleep at night because of the heartbeat.
Have you been drinking a lot of coffee?
Yeah, I usually have more than 3 cups a day.
Suddenly, Dr. Aoyong thinks about arrhythmias.
Arrhythmias are irregular heartbeats that caused by problems in the electrical impulse that regulate the heart rhythm. This disturbance may cause the heart to beat too quickly, too slowly, or in an erratic or uneven manner. Arrhythmias can be harmless in some cases, but in others, they may indicate serious heart conditions or leads to complications such as stroke, heart failure, or sudden cardiac arrest.
People at higher risk of arrhythmias include, firstly, individuals with underlying heart disease or previous heart attacks. Secondly, older adults, as heart's electrical system naturally change with age. Thirdly, those who experience chronic stress or anxiety. Fourthly, people who consume stimulants such as caffeine, nicotine, or certain medications. Lastly, individuals with sleep disorders like sleep apnea, which affect oxygen supply and heart function. Each diagnosis and proper management are important in preventing complications and improving quality of life.
Do you learn how the normal heart pump works before?
Yes, I learned in human physiology and genetic causes before. A normal heartbeat follows a precise electrical pathway. It begins in sinoatrial node, often called the natural pacemaker for the heart, and the SA node generates electrical impulses that initiate each heartbeat. The impulse then travels to atrioventricular node, located between the atria and ventricles. The AV node slightly delay the signal, allowing the atrial to contract fully and pump blood into the ventricles. Next, the signal travels through the His bundle and then into the right and left bundle branches, which distribute the signal to the ventricles. The result is the coordinate contraction of ventricles, which pump blood to the lungs and the rest of the body. This organized flow of electrical activities ensures that the heartbeat is in a steady, efficient rhythm. Any disruption in this pathway can lead to arrhythmias.
There are several main types of arrhythmias. Firstly is tachycardia, a condition where the heart beats faster than normal while at rest, usually over 100 beats per minute. Secondly is bradycardia, a slow heartbeat, usually fewer than 60 beats per minute, which can cause fatigue and dizziness. Thirdly is premature contractions. These are earlier or extra heartbeats that interrupt the regular rhythm, often felt as skip or filtering beats. Some arrhythmias are temporary and harmless, while others may require treatment. Fibrillation refers to rapid, disorganized electrical signals in the heart. Firstly is atrial fibrillation, the most common serious arrhythmias. The atria beat chaotically, reducing blood flow and increasing stroke risk. Secondly is ventricular fibrillation, a medical emergency where the ventricles quiver instead of pumping blood. It can cause sudden cardiac arrest and requires immediate defibrillation.
Let's move on to the symptoms of arrhythmias. In general, the symptom depends on the type of arrhythmia and its severity, but it has some common signs such as palpitation, which is the feeling of fluttering, skip beats, or racing heartbeat. Besides, Patient may have dizziness or fainting, which is due to reduced blood flow to the brain. Moreover, patient may experiencing fatigue, especially during physical activity. Lastly, patient may have shortness of breath or chest discomfort. Also, some people may have no symptom and discover the condition only through routine tests. If someone has experienced these symptoms above, they are encouraged to get an electrocardiogram (ECG) at the hospital. An electrocardiogram (ECG) or EKG is a simple, fast, and painless test that records the electrical activity of the heart. It is a key tool in diagnosing arrhythmias. During the test, small electrodes are placed on the chest, arms, and legs. These electrodes detect electrical signals and create a visual record of heart rhythm on a monitor or paper strip. An ECG can reveal the heart rate, which is too fast, too slow, or normal, the regularity of the rhythm, and signs of past heart damage or other abnormalities. Doctors usually use the ECG to diagnose conditions like tachycardia, bradycardia, atrial fibrillation, and others. Sometimes, continuous ECG monitoring, like Holter monitors, is used for capturing irregular rhythms that come and go.
Excessive caffeine intake, overconsumption of coffee, energy drinks, or certain medications can overstimulate the heart. Second, stress. Meta-stress releases hormones that affect the heart's rhythm and raise blood pressure. Third, irregular lifestyle habits. Skipping meals, staying up late, and lack of exercise can contribute to arrhythmia risk. Fourth, lack of sleeping. Sleep is essential for heart health. Poor sleep can disrupt the heart's electrical stability. Arrhythmias can have many causes, including both lifestyle factors and medical conditions. Now is doctor advice. First, reduce caffeine intake. Limit to 1 cup per day and avoid drinking on an empty stomach to reduce its stimulating effect. Second, regular lifestyle habit. Go to bed and wake up at consistent times, aiming for 6 to 8 hours of quality sleep each night. Third, reduce stress. Use relaxation techniques such as deep breathing, meditation, listening to music, or taking regular walks. 4. Exercise regularly. Engaging in moderate physical activities like brisk walking, cycling, or yoga 2 to 3 times per week to support heart health.
Here is the last part of our video, which is the reference list for our video. There are 5 members in our group, which are Ayong Sechuan, Chongliu Wenxian, Lo Shangheng, Wei Jingxuan, and Yan Enshi.
Thank you, doctor. I understand now. I will make some change. Thank you.
Okay, bye.
Bye bye.